So the basis of this project basically was to have a look at, is there an association between the clinical outcome tools that we use in daily practice, such as questionnaires and scores, and the objective findings that you could assess in a laboratory setting, such as the Gate Laboratory at CQ. And the interesting part was that there really is a vast difference between the subjective assessment and the objective assessment, and they do not necessarily correlate to each other. That was the one interesting finding. The other interesting finding was, do you need more than one tool to assess a patient with a knee injury, or do you need one tool only? And in fact, what we could demonstrate, that the questionnaires that we use in daily clinical practice are not sufficient by itself, so you need to combine them. Adam Bryant, who came to Rockhampton in 2002 when I arrived in Rockhampton, Adam myself actually founded a research unit within the School of Health, and part of that research was that we looked at knee function or laxity in young females who play netball, and our hypothesis at the time was that if you have a high estrogen level, the musculotendinous structures and the neuromuscular state of a female athlete basically increases the risk of an injury to the anterior cruciate ligaments, especially when they have high estrogen levels at ovulation. And it seemed that we proven a critical point here in saying, yes, if you ovulate as a young female, your musculotendinous structures become more pliable, so you are potentially at a higher risk of injuring your anterior cruciate ligament. And we have a number of projects going on. For example, patients with shoulder instability, the classic rugby injury where they pop out their clavicle. You may have seen that one. We do some very high-tech surgery in this hospital, one of the very few hospitals in Australia offering that. So we're doing some research about that, and we have ongoing research with knee injuries. Well, as a full-time surgeon, it's never easy to find time, and as such, I'm very happy that this has been finalized. And I think it gives you a little bit more credibility in terms of being an academic person. So it certainly is a positive milestone for myself. And we're certainly hoping that we can continue our work with CQU, and if I would have a vision, I would hope that we can keep the links between the hospital and CQ, so that we can get some of the graduates from CQ to work in our laboratory and maybe even do some research here with our clientele. That's my vision for the future.